My name is AMI. I am the Executive Director of AMI-Quebec. And if you ask who AMI-Quebec is a community-based organization that cares for the caregivers. The healthcare system usually pays more attention to people with mental illness or mental health challenges than to the circle supporting them. But we know that mental illness is a family affair. And when one person is ill in the family, the entire family is being affected. But families, it's very common that families either ignore their own needs or underestimate their needs for support. And we know that this is really very important because families who are not creating a healthy balance between their needs as caregivers and their own needs may compromise their capacity, or their role as caregivers. So we encourage families to create this healthy balance where they are going to be able to care for their loved ones, but also take care of themselves. So we are here to help.
Hi, I'm Connie and I'm on reception with AMI-Quebec. I'm the first person you will speak to when you call us. If you have a loved one or you yourself are dealing with a mental health issue, please give us a call and I can guide you towards our workshops or support groups or some external resources. Also, don't hesitate to give us a call. Thank you. Bye.
Hi everyone. If you're looking for some guidance when it comes to mental illness, our website, amiquebec.org, is a place to go. We've got lots of information about mental health issues like navigating the healthcare system and the role of family and friends. You can find details about all of our programs and services, and we've got an extensive resource list. It covers some topics that we can help you with and some that we can't, but you will definitely find somewhere that will help you get where you need to go. On our website, you can also sign up for our monthly emails so you can stay up to date with what we're doing. And we also invite you to follow us on social media. We're on Facebook, we're on Instagram, we're on Twitter, and we're on TikTok, all at AMI-Quebec. You can find us on YouTube as well, and we'd love to have you with us.
Hi, my name's David. I'm the newest staff member here at AMI. I was brought in to do IT and make sure that people have support when things stop working the way that they should. I'm a bit of an odd one out. So many of my colleagues here work in social work, mental health, and things like that, and I'm coming from a IT background, so I'm learning quite a bit and I'm absorbing a lot from my peers. If you're going to be using one of AMI's resources and you have trouble, chances are you're going to eventually be talking to me. So give us a call, we can help. Ciao.
My name is Blanche Moscovici. I'm an intake worker and family mental health counselor with AMI-Quebec. Welcome. I guide people in need of support services to the appropriate educational, self-care, and counseling resources, including our SOS Famille program, which I will talk to you about today. This is a free counseling support service for caregivers of a loved one suffering from mental illness or mental health challenges. It is a short-term intervention for long-term impact. If you're a caregiver requiring support, to access the service, you need to contact AMI-Quebec. I will follow up with an intake call where I explore with you what you're looking for, your needs and expectations of our service, what the current situation is, and how it's impacting you directly. If we agree that this is the right service for you, we will schedule a follow-up appointment, either virtually or in person, where we will meet and discuss what you want to work on, how you want to improve your relationship with your loved one, what other issues you may want to address. And we will set some goals that focus on what is in your control and what you can do to improve your current situation and well-being. If for some reason we decide this is not the appropriate service because either you are looking for therapy or are requiring therapy, then I will refer you to external resources. Over the many years, I have worked with many people from multiple cultural backgrounds, and the one common denominator that they all share is that they put themselves last. With AMI-Quebec, we put your needs and well-being first. So take that first step. Contact us. I will be pleased to follow up with you. Until then, have a wonderful day.
Hi, my name is Sylvie Bouchard, and I'm responsible for the BPD programs for family members at AMI-Quebec. So if you have a loved one with borderline personality disorder or with a difficulty regulating emotions, we can offer you guidance, support, education. If you are struggling with difficult situations, I invite you to join our workshops, support groups, and we also offer free one-on-one counseling for caregivers. As well, if you are the person struggling to regulate your own emotions or diagnosed with borderline personality disorder and you are looking for resources for yourself, you can also give us a call and we can orient you towards resources that you might find helpful. So if you feel stuck, isolated, or if you'd like to meet with other people who are facing similar challenges as yours, do give us a call or email us. So talk to you soon.
Hi, my name is Natalie Boileau. I am a counselor and family peer support worker at AMI-Quebec. For the last year, I've been collaborating with the CIUS Centre-Ouest de l'Île de Montréal to implement the Family Peer Support Service in the community, a service that has existed at the Jewish General Hospital for 6 years. This service aims to provide support, education, advocacy, and guidance to families and caregivers who have a loved one with a mental illness. Caregivers tend to forget themselves and don't realize that they too can benefit from some support as their loved one navigates the healthcare system. I'm here to remind them that they matter, that services for them exist, and that they are not alone. Currently, I've been meeting and presenting to various teams in the CLSCs within the territory of the CIUS Centre-Ouest de l'Île de Montréal in order to encourage healthcare professionals to refer caregivers to our family peer support service, where they will be able to speak with someone who understands, to a fellow caregiver. Our referral process is simple. A caregiver or healthcare professional can access it by going to www.amiquebec.org/ref, REF for referral. Our average response time between the referral and the first contact is 4 days. Within 4 days, you'll be able to speak with someone who can accompany you through challenging times. The healthcare system's first priority is the person who has a mental health illness. AMI-Quebec's first priority is the caregiver. We are here for you.
Hi, I'm Mark, the program coordinator at AMI-Quebec, and I oversee our programs. So basically, firstly, to tell you that all of our services are free at the moment, and they're all currently online. So to get more information and also to learn more about if you have tech issues or want to learn how to use your computer or tablet or phone to hook into our events, give us a call and we'll try to help you further. So we have 3 main program events that I oversee. The first is our support groups. They run on Monday nights. No registration needed to hook into those. Basically, you just show up a few minutes before online. And we cover things like bipolar disorder, depression, anxiety, hoarding, and a bunch more. We have great facilitators who run those events. Secondly, we have our Facebook Live events, and they're Wednesdays once a month. And my colleague Tony has community members and professionals from around Montreal in our community talk about current mental health trends going on in Montreal, but also worldwide. So those are really great, and you can interact live on Facebook, asking questions and comments live during those events on Wednesdays, once a month. And thirdly, we have workshops, and workshops are different because they require you to register. They're more intimate events, very private, usually 10, 12, 15 people interact together, and we have really great facilitators there as well, cover things like coping skills, anger management, boundaries, setting limits. We have creative expression, which is artistic collage. We have a meditation series. We have a hoarding series. We have a lot of things going on there in terms of our workshops. But you have to register because they fill up fast. So once again, we have support groups Monday nights and occasionally on Wednesdays. We have our Facebook Live videos Wednesdays once a month, and we have workshops throughout the month, and they run season to season to season. Remember, the workshops, you got to register. So contact us at amiquebec.org. Give us a call. Subscribe to our emails. Thank you.
Hi, I'm Oliver. I'm the Young Carers Project Coordinator at AMI. I work with young people who help to support a loved one due to challenges with their health, their mental health, a substance use, or another challenge. And right now, a lot of that work is focused on awareness because when we think of caregivers, we typically don't think of young people. And so that involves informing organizations of this issue so that they can recognize young carers when they come to them. And it involves working with them to maybe develop new programming, adjust their training, or otherwise find ways to support young carers. In the longer term, it also means helping to advance research in this area and helping to effectuate change on a policy level. And right now I work directly with young carers in our Young Family and Friends support group online once a month. That's a place where we can connect, provide peer support to one another, share different tools, and we can help to refer them to those other services. And this is where it becomes really clear that the experience of being a young carer differs really widely. But we do benefit from coming together, having those common experiences and struggles validated, and finding new ways to move forward.
Hi everyone, my name's Tony. I am the Outreach Coordinator at AMI-Quebec. My role at AMI is to get anyone and everyone talking about mental health and mental illness. That means caregivers, that means loved ones, families, friends, people living with mental illness, anyone and everyone. The way we do that is I coordinate presentations in schools, in CEGEPs, universities, workplaces, community centers. I do tabling. We really go anywhere that anyone wants to hear about AMI, wants to talk about mental health services in Montreal. I go, or someone from our office will go, and we'll try to make sure that someone is there to represent us. We want people to start talking and to reduce stigma. At the end of this video, you're going to see how to follow us on Facebook, how to follow us on Instagram, how to follow us on TikTok. We have a Twitter account. We have a YouTube page. All of these things are all AMI-Quebec. It's one name. It's pretty straightforward, which makes it really easy to follow us. Make sure you follow us, sign up for our newsletter, check out our website, give us a call. All that information is going to be on the next screen. Have a great day.